Okay, I'm Jamie McCall. I'm the chair of Theatre 3 this afternoon. I work for PLB. We're a museum and design heritage company who sponsor the event here. A fabulous new talk that we've got. So this is going to be museum wellbeing programs, avoid doing more harm than good. And our speakers for today are Victoria Ryves, Head of Culture and Engagement, Wentworth Woodhouse Preservation Trust. We've got Michelle Kindleysides, Head of Health and Wellbeing in the Beamish Museum. And last but not least, Tamsin Russell, Workforce Development Lead of the Museums Association. If you could just show your appreciation.
Right. Hi, everyone. I'm loving this. I feel like I'm living my Britney Spears dreams here with this headset on. So in today's session, we are going to talk through a couple of different things. We will introduce ourselves so you know who the heck we are and why we're talking about this. And then we're going to turn the tables a little bit and we're going to ask you to do some thinking, which is a tough ask at lunchtime, but I have faith in you all. And in today's session, we will also end by looking at what support looks and feels like. So what we're talking about today is museum wellbeing programs. We know that museums and heritage sites across the country are making a huge difference to communities where they live. It's not just us saying that, there's other people saying it too. So the 2017 All-Party Parliamentary Group report, Creative Health, said that engagement in the arts is seen to enhance well-being and quality of life, and that it's essential for the prevention and treatment of chronic health conditions. Another report said that visiting heritage sites is actually saving the NHS 193.2 million through reductions in GP appointments. Our intention today is to support you to deliver these programs sustainably and ethically, and we're going to give some suggestions for the delivery of the work and what you need to have in place. We're going to be candidly sharing the things we've got wrong. In a public forum, we're going to talk about all the things we've got wrong and hope that you can learn from our experience. So who are we? Why are we talking to you about this? The three of us are just a part of the Glam Cares board. Glam Cares was established in 2020 in the dark days of the COVID-19 pandemic. And we established ourselves as a care and support network for people that work with communities in galleries, libraries, museums, and heritage sites. We offer training, we offer networking, peer support, and advocacy. And if you're at a loss of what to do next Thursday, you could join us at our very first conference. Plug successful. So individually, who are we?
Hello. Hi, my name's Michelle Kindleysides, and I'm the Head of Health and Wellbeing at Beamish Museum, can't speak, which is a large open-air museum in County Durham. Has anyone been? Yay! That's good. So we are a huge museum, lots of different teams. I'm head of the health and wellbeing team, and there's just three of us in our separate little team. And we run a programme of group sessions and activities at the museum for people with a range of health needs. So people living with dementia, people living with mental health issues, people experience loneliness. We'll talk a little bit more later, but since 2022, what we've put in place in our team is myself and my two colleagues have regular individual external supervision. So from someone who is used to working in a clinical setting, and we've factored this into our annual budget. The reason we went for this is because obviously the time, 2022, we were still coming out of the pandemic. Myself, I felt like I was rapidly approaching kind of burnout. My home life and work life were very, very similar in terms of dementia caring role. And we needed someone who had that expertise. So I asked colleagues in different organisations at a hospice that we work with, what do you have? And that's the route that we took. We also run large groups of We also run large group workshops for our volunteers and staff. So we have 15 volunteers that help us. We run them around things like anticipatory grief and loss, mental health first aid, because a lot of our volunteers have come to us because they have been in a caring role or been affected by some of these health conditions. As a museum as a whole, we've recently joined the Better Health at Work scheme. And also, as part of being an employee and a volunteer at Beamish, through our insurance company, everyone can access free counselling and support. Okay.
So I'm Victoria. I'm Head of Culture and Engagement at Wentworth Woodhouse. For those that haven't visited, we are a Grade 1 listed mansion, an 18th century mansion up in Rotherham in South Yorkshire. We have the largest facade of any building, and we're wider than Buckingham Palace, and apparently have a room for every day of the year. Not that I have found them all yet. Our wellbeing activities, some of which are very similar to what's being delivered at Beamish, but some are different. But we're very early on in our wellbeing journey. So one of the reasons that I was brought into the organisation is to help move Wentworth in the direction of delivering really good, sustainable wellbeing programmes. We offer art-based therapy sessions. We run a memory cafe, and we do a lot of things in the many acres of our gardens. We also have over 250 volunteers, and the majority of our volunteers are volunteering to improve their well-being.
Fabulous. Thank you. I'm Tamsin Russell. I work at the Museums Association, and my responsibility is workforce in the broadest sense. So I look after workforce policy, advocacy, professional development, careers. And one of the key areas for the Museums Association is about having a sector where organisations are prioritising the well-being of their staff. We did some research and have done research in this area for a number of years. It first started with our research into bullying in museums. So please have a look on our website, 2018, with some very clear recommendations for line managers and organisations. We felt it was really important that those individuals and the organisations stood up, essentially. We did some research into front of house experience of work, often a particular group that isn't necessarily as highlighted or involved in lots of museum practice. And what came out very clearly from that piece of research in 2021 was that individuals didn't feel recognised, they weren't given opportunities to be involved, they weren't given opportunities to grow, they were seen very much as an asset rather than part and parcel of the core museum work. And that all contributed to their sense of lower well-being. So well-being came out as one of the key principles. And that piece of research has 40 recommendations outlined under the different aspects of work. Most recently, we did some research in 2022 on workforce wellbeing. We got a really good response rate. And I should say we've had really great response rates around all of this. So over 500 for bullying, over 350 for front of house, and over 650 for workforce wellbeing. So it's an area that clearly resonates within the sector. Our research report is on our website and again includes a number of recommendations. Now, unlike Michelle and Victoria, we aren't active in the space of delivering wellbeing workshops. We're not working with communities or visitors around content or around experiences focused on wellbeing. But what we do know is that as the professional body for people that work in museums and work with museums, that we have a responsibility more broadly for everybody's wellbeing, and we can be used as somebody to shine that light around wellbeing being an important part. And as part of all of this, we have added and layered on additional aspects to this work. So we had, during the pandemic, a wellbeing community on social media. People still come up and say that was a lifesaver. We have a resource hub, a wellbeing resource hub that has a variety of different resources around anything from survivor syndrome to cyberbullying to emotional loads and emotional labour. And that's another important point that I want to highlight, is that we know increasingly we're working with audiences and communities that they themselves are dealing with hostile environments, microaggressions, mental health issues. In addition to the fact that lots of the projects we're working on in museum collections around decolonising, again, brings up a whole raft of trauma and content that doesn't sit well with anybody. So we need to make sure that everybody is able to deal with that themselves and to look after themselves, but also to make sure they create a safe space for those conversations. Our Wellbeing campaign was launched just about a year ago, and as part of that, we've delivered wellbeing workshops for small organisations, and we're currently undertaking some more detailed workforce wellbeing research into the experience of museum professionals of colour, and the different complexities and nuances that brings in terms of the work that we're doing. Later this year, we'll be doing an online learning course. So why am I highlighting all of this? This is an active area. It's a clear and present issue for all of us in the sector. Please utilise the Museums Association to either help you or to signpost to your organisations about what we're doing so they can sit up and take notice. And I'm now going to hand over to Michelle.
Thank you. Thank you. So don't worry, we're not going to ask you to do any kind of role play or anything like that. It's just giving you a chance to have a little think, really. So this time last year, I was sat where you are, listening to Victoria speak about glam and the work that she does. And it was like, oh, someone else understands, someone gets it. And then I've realised that lots of people get it. And I think a lot of it is just being in a space where you can talk to others who get it and are doing it. Because we all recognise the work that we do in community engagement is incredibly valuable and brilliant, but it does have its own challenges and considerations that we need to think about in order to deliver this work safely, ethically and sustainably. So we're going to talk through some real life scenarios of wellbeing and community work that we or people that we know have done in a heritage or outreach setting, and just going to ask you to think yourself, you can talk to your neighbour if you like, about the audience. So think about their ethics, their needs and ethics, boundaries. So in terms of personal boundaries, professional, safeguarding issues as well. Any training that you think is missing or is an example of where we've got it right. Expertise needed and support and care. And as Victoria said, we're sharing these with you. It's not we've done this completely right. There are things that we've done we would do differently now, things where we haven't got it wrong, but that is all part of the value of Glam Cares, is being honest with one another about where we have done things wrong or differently now. So we'll go through to the next one. Oh, thank you.
Okay, so scenario number 1. You are delivering a weekly social group for older adults as an outreach session in a community centre. In this session, you are aiming to help participants meet new people, and you're using museum objects to spark curiosity and conversation. Ultimately, it's hoped that attending these sessions will help people to feel less isolated and to boost their well-being. But during a group session, one participant shares with you that they are really struggling with their mental health and they urgently need support. What would you do?
You need a countdown clock.
Yep.
Do, 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 do.
So I need to make the countdown theme tune. We're going to give you sort of 15, 20 seconds just to have a little think. It's also interesting to see so many people nodding. It feels like this is a familiar situation to some people. Okay. So this was something that happened with an organisation I used to work at. And it was really, really, really early on in our journey delivering wellbeing activities. And in this particular session, I can remember it like it was yesterday. The session wasn't thought to be explicitly triggering. It was a session about Victorian Doncaster, and we were having a go at making some sweets. That's all we were doing. But it was a real lesson for me as a manager to expect the unexpected in community engagement, and the importance of having a really robust risk assessment in place that includes navigating these kinds of scenarios, regardless of the topic you're talking about. We in museums, we're used to writing risk assessments. We risk assess slips, trips and falls like they're coming out of our ears, but we don't always include mental health risks on our risk assessment. And that's the risks for our participants, but also the risks for our staff in return. So it completely changed our approach to risk assessing. It also flagged the group environment that often we find ourselves in can be really challenging. We have a duty of care to that entire group, not just to that individual. So what we did from there was we worked out phrases and prompts that staff could use to be able to control the group, but also move a person away that perhaps needed to talk to somewhere else in the room whilst being able to navigate what was going on. This particular incident also prompted change in terms of training. I realised it was really important that even in a situation like this, that my staff were trained in how to respond to people that might be feeling particularly vulnerable and potentially feeling suicidal. There's a really great resource that we can all access for free from the Zero Suicide Alliance. It's a really good e-learning, which I would recommend you looked at. It also showed us that we needed to have effective signposting in place. We needed to be able to explain to people who these sessions were and weren't for, so that we were prepared with what the needs might be. The staff now also lead these sessions with a list in the back pocket of signposting organisations that you can hand to people. So if you're not feeling great, my responsibility here is the museum objects, but perhaps you might want to talk to one of these people who can help. But Beamish have taken this one step further.
We have. So this similar has happened to me in the past quite a few years ago. Somebody who attended a regular weekly session with myself. It was a walking group, so not even using museum objects. But I think that person obviously trusted me and the team more than she trust kind of her GP or a clinical setting. So she then rang me when she was going through a mental health crisis. Thankfully, I'd done mental health first aid. I was like, right. So okay, talked us through it on the phone, kind of asked her to go and get help. But still, I was left thinking, and I didn't really know what I should have done. So now, because over the last few years, our team have been really proactive in shaping what mental health community support looks like in County Durham, that means that I know who to go for help and support. Many of our participants are referred from occupational therapists, adult mental health teams. So that's straight away a named person that I can say, that person that you referred, I'm a bit concerned. If it's somebody like this who doesn't come with a referral, I can still contact this mental health. They call them huddles. They have them every 4 o'clock, twice a week. So I can attend that and raise any concerns for someone living in that area, which has been a massive kind of help. We've only had to use it maybe once or twice in the last couple of years as a kind of safeguarding, but it's really important to have that network of support around you, because we're not clinicians, but lots of people treat us as if we are.
Yeah, so the one big advice is to find out what there is where you're delivering this work. There will be these networks that exist for health professionals, and there's nothing stopping you from tapping into those as well. So our second scenario.
Oh, there I am with a bus. I'm so proud that I passed my test last week. So scenario 2, you are part of a very small and busy team, which we are, delivering community engagement activities. One of the team members has been off work unwell for over a week, and it's not clear when they will be well enough to return to work. Your team leader has asked you to also deliver their community group activities too. I've put two while they are away. So what would you do? This might be another common theme in small, busy teams.
And the answer, getting a clone, isn't
Yes.
possible.
I'll just give you a few seconds because it's slightly awkward silence.
Yeah.
When you're doing a
You can tell that you work in community engagement because silence is petrifying.
But does this sound familiar to some of you in the room? It's probably not even just community engagement either. So Yes, this has happened to many of us in the board. So first question, do we automatically say yes? I can definitely put my hand up and say, especially when I was quite new in post or early on in my career, yes, I'll do it. I'm fine, I'll do it. And I think that's naturally what we would do, because we like to be seen as a can-do person. I can take things on. Where will this lead? But this potentially might be a long-term change. And if you say yes straight away, that you can take on another person's role, it may not be addressed again in the future because, Michelle can do 2 workloads or so. Or it might be maybe they've got a smaller workload than you. So could you successfully pick up another delivery? What information will you need? So make sure you're not going in there blind. But I think it's really important to say possibly, well, no, or yes, but. So you could potentially work out a short-term plan. So you're not constantly firefighting for weeks upon weeks upon weeks. So maybe talk to your line manager, ask for a review afterwards. And if that person's going to be off long-term, look at a long-term plan. By saying yes, but you're not exactly saying no, but it's also really positive. You're showing that you're planning, you're thinking ahead. You're not just taking on more and more workload. It shows that you're responsible as well. So it's not a bad thing to say no, or no, but yes, but. Also, if you do need to reschedule sessions, meetings, people will understand. I think that's something that I never thought people did when I first started. I have to do this. We are all human. You are human. We are human. People will understand. So take this as permission to be a human, please.
Okay, our third scenario. Your wellbeing sessions are doing really, really well. You have been shortlisted for an M&H award, and everyone knows that the work that you're doing is excellent. So as a result, you've been approached by an NHS provider. They are asking you to deliver some of your sessions, but for young people aged 12 to 15 who are at risk of disordered eating. The sessions will take place over 10 weeks with the same young people directly referred in. And each week you'll be exploring body image through time using artifacts and art. It's a really strong possibility that the young people are going to want to talk about how they're feeling, how they feel about their bodies and their disordered eating. What would you do? So this is a real scenario that happened when I worked for Heritage Doncaster. We ran a really amazing PR campaign around the work that we were doing in communities and the impact it was having, which meant we had lots of approaches from people wanting to work with us, which was excellent. But it was a real exercise for me in the importance of saying no. I had to do a lot of thinking about whether we were the right organisation to deliver some of this work. Not invalidating the power of the work, but there were some audiences that we were approached to work with where it simply would not have been ethical or appropriate for us to do so. For example, it was asked whether we could deliver veterans support, but it was just going to be us in those rooms with nobody else to hold those people therapeutically. The reason I said yes to this proposal is that CAMS, the Children and Adolescent Mental Health Service, were going to work in a really sincere collaboration. They would ensure there were 2 mental health nurses in the room who would support those young people therapeutically, leaving us museum lot to do the museum cultural stuff. Crucially, those same mental health nurses would also stay behind afterwards to provide support to our staff who had spent the past 2 hours working with really vulnerable young people. Without this in place, I wouldn't have said yes. The debriefs were really, really crucial in making sure that this was sustainable for our staff as well as the young people. And the programme ended up being really successful as a result.
Next one. So scenario 4, this is quite specific to the work that I do, but it might be similar to some of the things that you do too. So after running a session with a group of residents and carers from a local care home, one of the volunteers who supported the session opens up to you about their experiences. They talk to you about their parents living in a care home and that they passed away a few years ago. They get quite upset about it as they are talking to you, but they say they wanted to talk to you as they know you've experienced something very similar and would get it. So have a think. It might not be something you've experienced. It might be something that you might come across. It might be something that happens outside of work as well, actually. So this, as you can tell, is something that has genuinely happened to me. So a few years ago, as well as delivering the majority of the sessions for people living with dementia, I was also a carer for my nan, who was living with dementia, who was in her late 90s and was blind and lived in a care home at the end of my road. So I didn't really have much difference between work and home. And I think this is when it really, really was obvious to me that kind of compassion fatigue is a genuine thing. And I don't think I recognised that until somebody said it to me. Yes, we are compassionate people, the work that we do, and we take on a lot of things. Where does that go? We need to have an outlet for some of this. There's a difference as well between empathy and compassion. So for me, it was more empathy because I had been and was in that same position, whether I was at work or at home. And it was the constant emotions, the same at all times, and feeling the same emotions. Compassion is still really, really important, but that's recognizing the emotions, but wanting to take action. You're not actively taking on those emotions. So I think for me, reaching near burnout was this empathy kind of overload. So individual responses in these sessions can be really difficult, but we need to balance these with professional responsibility. Otherwise, it's unsustainable. So in that kind of particular context, because that wasn't a one-off either, other people naturally come to talk to me at Beamish, which I love. I love being that person, but it's a lot to take on. So we ran grief and anticipatory grief workshops for all of our staff and volunteers within the health and wellbeing team. As I said earlier, a lot of our volunteers are with us because they have been experiencing this as carers or somebody living with dementia. We make sure that we have time before and after the sessions to debrief with whoever's delivering as well, just to check how people are feeling, any kind of tricky situations, not like, all right, thank you very much, see you next week, bye. It's really important to give the volunteers and your staff that time. We try and make sure the volunteers have regular social events, so we're a nice kind of cohesive group as well. Something that we've introduced quite recently is a role profile for our volunteers. We have 500 volunteers at Beamish, but our volunteers do a really specific role and we need specific skills. And also making sure it's clear that they can change their mind about volunteering with us if they find it too difficult at times. We totally understand that.
So in these scenarios we've described to you, there was a real risk that we could have been doing more harm than good, either to the participants or to our staff. We know that most people engaged in museum or heritage wellbeing work are museum professionals and people, but they're not necessarily therapists or psychologists. We do, however, know this work is really important and it's making a difference to people's lives. So, to sum up, how do we make this sustainable and safe? So we're going to very quickly sum this up. So first of all, your audience. Consider whether you're the best placed organisation to work with a particular audience. Saying no is okay and very valid. It's important that you're clear who your wellbeing sessions are suitable for. Would you be able to accommodate someone at the point of crisis? And if you're going to work with people that are in crisis or particularly vulnerable, what do you need to have in place?
Another thing to always consider is risk assess. Like we say, we risk assess physical kind of risks all the time, but we also need to risk assess mental health risks as well for participants, staff and volunteers. So at Beamish, we now, I don't know how you do your risk assessments, but we would say like high risk is 5, low risk is 1 in terms of physical injury. But we've also, working with our health and safety manager, put those scales in for kind of mental health as well. So 5 would be really serious mental health crisis, that kind of thing. And make sure you do this as standard as well, not just a one-off. Always think about it and be prepared for the unexpected to happen as well, and put things in place to try and reduce that happening.
Partnerships. Partnerships are really important in this work. They can support you where you don't have the expertise, like in the CAMS example I gave, and they can also help you to support and share ideas. They're also a really good resource to help tap in to their training and perhaps their referral systems. So by working with CAMS, it meant that my staff were also able to receive some of the training that mental health nurses received. So it was a really good sort of partnership there.
Also consider training for your team, your volunteers as well. Things that we've touched on today are things like suicide prevention, mental health awareness, trauma-informed practice, signposting, safeguarding. There's make every
Contact count.
Contact count, thank you. That's a really useful one. And keep reviewing these training needs as your work evolves, and the types of audiences and participants you get will change as well. So we're constantly, as we get new referrals in with different needs, more complex needs, we're constantly looking out how can we become better at what we do.
Personal boundaries. It's really important that you work with your staff and work with yourself to understand what your triggers and boundaries are. Tamsin in a minute is going to talk about an individual wellbeing plan, so I'll leave that to her without stealing her thunder. And lastly,
so the theme of today is staff wellbeing. We must look after ourselves and the people that do this work. We are human, we're all human. We don't work in a vacuum. Issues that affect participants also affect staff too. And the term I remember from last year, vicarious trauma, you will probably, without realising it, be kind of absorbing people's emotions, people's experiences. And like I said earlier, where does that go? If it just stays inside, that can become an issue. So look after yourself.
And we know that not all organisations are able to pay for supervision or counselling support for your staff. So this is a bit of a trailer. At Glam Cares, we've been working with Heritage Doncaster, who are an organisation that delivers community wellbeing in an outreach projects in an outreach context. We've worked with them to create and co-produce a toolkit for how you might deliver peer support in an organisation. So we wrote this alongside a trained counsellor, and it was over a 9-month period. We tried out lots of different methods, and we think we've come up with a replicable system where you'd be able to pick up this toolkit, take it to your organisation, and work out what peer support looks like for your teams. It will be going live next month on our website.
Thank you. Thank you for both of those reflections. And what I really loved about the scenarios was it just demonstrated how important it is to be honest about our experiences and the descriptions of the situations we've been in. And I would challenge, or I would expect, that it's quite unlikely that we build in that time in between or after a particular community workshop or at the end of a project. I'm sure in the greatest will in the world we want to do that, but we don't do that. But that's so critical. We have to make sure we create that space to process, to share that vicarious trauma and impact, and then to be able to leave that in the room at work. One of the things that we're really passionate about is we don't want that flow from your work life into your home life that might then mean that the time where you should be resting or having fun is adversely impacted from everything you've experienced in the workplace when you're working specifically in these places that are just much fuller of uncertainty and emotion and response. So process, share how you feel, leave it in the organisation, but just make sure you're improving the whole time. I've already mentioned the Wellbeing Hub. This is another really blatant highlight this is open source. You don't have to be a Museums Association member. We add to this every quarter. I'm currently working on some guidance around sexual harassment, chronic health conditions. We're doing eco-anxiety in August. Sounds like my band on tour, eco-anxiety on August. And we're also doing something around boundaries. So if there is a wellbeing issue that's resonated, either through what you've heard from Michelle, Victoria today, or as part of your own professional practice, and you would like us to be able to point to, the Museum Association says, then please let us know. One of the final ones before I hand over for, could you move it on? Thank you. And disappeared.
It's just gone.
It's gone, 1 second.
Oh,
It's fine. It was I think it was
the
just
final slide.
the final slide. So the Wellbeing Hub has a variety of resources, as I've just explained. One of the ones that we put in place this time last year is an individual wellbeing plan. Now, we do not feel that individuals should be the people that are taking ownership necessarily for the experience of their organisation. The organisation should absolutely step up. But what we do know is that individuals who can take personal agency around their own well-being are more likely to have positive outcomes. So if you are that person that would like to have your own individual plan, we've got a resource on our website that enables you to think about the factors that impact your well-being. And then you can use this as a document, either to have a conversation with your line manager or as a self-audit. Finally, just to say thank you very much, and we're going to be opening for questions. And we're going to be over at the Ambience
Networking Lounge.
Ambience Networking Lounge. You said that quickly, from 2:00 anyway. So if you haven't got a chance or want to ask something in private, feel free to do so. And this time next week will be our annual conference. So please have a look at our website.
Thank you. Okay, are there any questions anybody would like to ask now?
Everyone's desperate for a sandwich.
No, everyone's thinking about, oh, there's one more. I'll set that.
Thank you very much. My question was about the kind of anticipatory grief training. Did you deliver that in-house? Did you get kind of a specialist in to train? What was the process with that?
It was the same lady who delivers our supervision. So she's a trained counsellor, therapist. She works one-to-one, but she also does sessions for groups. So it wasn't compulsory if anybody didn't want to come, but it was there if volunteers, staff wanted to come. So yeah, she delivered, I think it was maybe about 2 hours. We didn't want it obviously a whole day talking about grief, anticipatory grief, but it was a really useful session. And then from that, if any of our volunteers or staff, volunteers, if they wanted to have a one-to-one session, they could get in touch with her as well.
Within our organisation, we didn't have the budget. So we asked some of the partner organisations that we work with. We work with Age UK and the Alzheimer's Society, and they were able to offer something quite similar because it's something that their staff are also trained in. So that kind of partnership loop, and the whole point of a partnership is it's mutually beneficial. So being able to kind of tap in some of their support resources as well.
Okay, anybody else?
Thank you. I was wanting to ask a question about the research that you're going to be doing with sort of impact on staff who are people of colour.
Yes.
Will there be work being done around the impact of working with sort of triggering collections, or will it be more sort of broad than that?
It's a really good question. So we already have guidance around working on decolonising projects and what organisations need to take into consideration. So we've got some guidance and some hints and tips about that, also communicating it and what that means from a triggering perspective. We don't know. So the really exciting thing about this piece of research, and we had underrepresentation for a number of different groups in our research, one of which were museum professionals of colour. And so what we want to do is do a deep dive. So I can't answer the question because it depends on what they say, because we're leading everything from them. But really good question.
Okay, one last.
Sorry. Coming off the last question, this might be too specific maybe, but I was wondering, because it does tie in with wellbeing, I'm doing some work with diversity and inclusion groups at the hospital trust that I'm working with collections engagement for, because we have an art collection. It's a very specific area of work, but one of the issues that has arisen for me kind of starting to audit the collection is that we have such little work by people of colour. It's actually quite shocking, and we may end up working with the BAME network this year, as they've expressed a lot of interest. I was wondering if you could point me towards any specific resources around how to kind of deal with issues that will naturally, I think if we work with that network, those issues are going to come up and should come up. But as a white person, I feel like I'm not the best place to necessarily facilitate wellbeing work around that. And I was wondering whether you had any tips or resources.
Yeah, so the person I'd recommend you seek out is the amazing Sandra Shakespeare from Museum X. She did a presentation yesterday around trauma and empathy in a collection space, specifically looking at collections in Cornwall and archives in Cornwall. She has a film and some guidance. So she's your go-to person and she would love to share. But that's my recommendation. Sandra Shakespeare. Sandra, yeah. No worries.
Okay, I think that brings the session to a close. If you could leave your little green boxes on your seats for the next tour, and if we can just give our appreciation to what was a really fantastic talk. Thank you.